Hello everyone, this is Dr. Li again. Today I'm going to share one rare case. Dermatologists want to rule out basal cell carcinoma, so they send out a straight biopsy sample. So low power, we can see tons of information in the dermis, and then we can see some different color basaloid looking cells, but just in the DEJ junction. From this two piece, you can see some darker color cell. And then let's zoom in to see whether we can find any BCC here. So not really classic picture for BCC. Even we see this basaloid cell, we do not have this mucin surrounding this basaloid cell, and then this cell not really palisaded, and we could not see any kind of this retraction artifact for the BCC, but we can clearly see this kind of not normal keratinocytes in the DEJ junction. So this is not a classic BCC, so we have to rule out other malignancy as well. So you have even in some area we may see some maybe pegydoid spread, but not really nice. But we can see this kind of cells going up a little bit. Here we also can see this kind of cells. So when you see this DEJ basaloid cell, and then also have kind of this pegydoid spread, first thing you may also think about that may be a melanoma. That is always the first thing you need to rule out when you see this almost look like confluent growth and a little bit pegydoid. And then the other stuff you need to think about is squamous cell carcinoma in situ. And when you think about that, you may also think about could it be kind of pegydoid or extra memorial pegydoid, because we can see this hair follicle. So clearly we know this is not from the breast. So it could be extra memory pegydoid, but this big spacious gland, it should be in the head and neck area. So the extra memorial pegydoid is really unlikely. Then if I tell you when we do S100, SOX10, and melanate, all of these markers are negative, and then P63, P40, CK56 also negative in these cells, and we need to think about other more rare differential, because clearly from this sample we do not see any invasion. You may suspicious this is invasion, but you can see still connect to the epidermis. It should be a hair follicle, so this kind of malignancy cell just trickling down the hair follicle with these tons of information, including this plasma cell. Another piece, a nest in the dermis looks like that, but you can also imagine if we cut more section, it should be connect to the epidermis. So this is not clearly invasion. So all the malignancy cell here just basaloid looking cell with this in situ looking. So when we exclude squamous cell and melanoma, I think the other thing we need to think about, could it be sebaceous carcinoma in situ? Then we can do some sebaceous marker, and then I can tell you that EMA negative, and also adipophilin, that is a good marker for sebaceous differentiation, also negative. Then we need to think broad a little bit, and then if I tell you when you do CK20, that is positive, so I think a lot of people already know what it is. That is CK20 positive, CK7 negative Merkel cell carcinoma in situ. This is a really rare entity, but there was some case report to see that, and then the prognosis is relatively good if you just find this in situ area. the follow-up for this patient when they complete excited in situ, the patient several months follow-up, no recurrent. So let's see whether we can see other hint from higher power. Yes, when we know the CK20, I think when we're going back, you can see, oh, a little bit too basaloid, and then the cell kind of overlapping. We have a burst wall that's molding, because basal cell carcinoma is just kind of another neuroendocrine carcinoma. And then we have a lot of these apoptotic body. And then the chromatin pattern may be a little bit like the salt and pepper. We do not see really big prominent nucleoli. So of course it's really easy to go back to thinking about Merkel cell, but when you have the case, you do not have the staining. I just want everyone just bear in mind Merkel cell carcinoma in situ is something that can happen in daily practice, even though it's really rare. So you need to bear in mind if they want to rule out BCC, but it's not a classic picture for BCC, because it is nice mitosis, not really good, another mitosis, not really good for BCC. You need to think about other thing. So the differentials should be melanoma in situ, squamous cell carcinoma in situ, sebaceous carcinoma in situ, and this one, Merkel cell carcinoma in situ. Thank you for your attention. Hope you enjoy this case.